Hi, everyone. Welcome to the first session of ASI's Reopening Together, a free weekly series to discuss guidelines and share ideas on how we as a community can successfully and safely reopen our creative industry. These sessions run virtually every Tuesday in June at 1 p.m. We want to especially thank you for making the time to join us during this challenging and important moment in our country. We feel it's important to iterate that ASI supports the fight for racial justice. Today and every day, we stand in solidarity with the Black community and the Black Lives Matter movement. We know that art serves to amplify voices, perspectives, and stories, and we encourage our arts and cultural community to take this time to listen to Black artists, leaders, and organizations, and to respond to their calls to action. Today, we're going to hear from ASI's Executive Director, Jennifer Swan-Kilpatrick, and Grants and Programming Director, Holly Grant, as well as guest speakers Dave Swartz, the President and CEO of Buffalo and Erie County Botanical Gardens, and Marisa Wigglesworth, the President and CEO of Buffalo Museum of Science. We'll have time for a Q&A after the presentation. And now I'll turn it over to Jen and Holly.
Hi, everyone. Welcome, and thank you for joining us for our first Reopening Together series. My name is Holly Grant, and I am the Grants and Programming Director for Arts Services Initiative of Western New York. For those of you who aren't familiar with us, we are the region's Arts Council, and we provide resources and tools to individual artists and arts and cultural organizations from across Western New York. Just want to do a few housekeeping things before we get started. You have been joined into this with your audio and video off. We ask that you please keep yourself muted and your video off so we don't overwhelm the system. If you have any questions as we go throughout the process, you can submit them in the chat box. Our very own communications manager, Rochelle Tormino, will be bringing those up at the Q&A at the end of the presentation. She'll be moderating that for us and keeping an eye on your questions. This presentation is being recorded. We will pass this on. We will send this out to everyone who is registered. We will also post it on our website after. So those who were not able to join us in person will still have access to this information. Today's presentation is meant to be a high-level overview of the guidelines that we anticipate will be set for the arts and cultural field. Next week, we will go into breakout sessions that will talk more about specific art forms and services provided and the unique challenges around those. So if you have any questions that are specific to your art form or to the service that you do, please hold those for next week. Or you can submit them through the chat and we will make sure that we include them in next week's discussions. Just a quick note, ASI cannot and is not providing legal advice. This series is intended to be educational and to help inform you of what resources and information are available to you. The guidelines we are about to present are just our best guess of what we think the state will be submitting for us. All the guidelines are set by New York State, and all the guidelines and regulations are constantly being updated. We are not the final authority on anything legal or any other planning initiatives. We're just trying to help navigate the intense amount of information that is out there. Before this meeting, you should have received several documents via email, including a copy of the New York State Business Safety Plan template, several website links, including to the CDC, OSHA, Department of Health, and the Buffalo Niagara Partnership's Guide to Reopening. These documents will be forwarded again along with today's recording, and we will also post those on our website. So let's just jump right in and get this over with. We understand that the reopening process is very overwhelming, and we are about to throw a lot of information at you. For those of you who have already started compiling your plans and putting your regulations together, this will probably just be a review of things that you already know. For those of you who haven't, hang in there. It's going to be overwhelming. It's going to seem like a lot of information, but I promise once you've had a chance to digest it and really dig in, it will make sense. You will get it. The arts and cultural industry at this point is set to open in phase 4. This includes the arts, entertainment, recreation, and education industries. At this point, we don't know when we're going to enter phase 4. Earliest estimates say it could be in July, but that depends on how well the virus is contained and if there's a resurgence that sets us back into an earlier phase. A quick note about reopening. Just because you can reopen does not mean that you have to. You and everyone at your organization need to feel comfortable with your safety plan before you start opening to the public or even just allowing your staff back into the office. You will hear from many organizations over the coming month who have started drafting their plans. Some of them are planning to hold off reopening until the fall. Others are ready to go as soon as we are allowed to. You need to decide what makes the most sense for your organization based on your unique set of circumstances and your capacity. This is not going to be business as usual. So as you may have heard, administrative and office support will be allowed to reopen in phase 2, which I believe started today. The guidelines and affirmation form for phase 2 are available on the New York Forward website right now. Any storefronts or retail businesses are also allowed to reopen. This might potentially include a gift shop. In addition, retail, rental, and commercial building management are also allowed to reopen in phase 2. So if you rent a space from a commercially owned building and you have not heard from your property manager about their plan and policies, you should probably reach out to them. In addition, if you rent studio or rehearsal space, or you have a resident company or artist that rents your facility, you might also fall into this criteria. You should check the New York State guidelines for this category to see if there's anything specific to that industry that you will need to include in your safety plan. That being said, before any organization can reopen, you need to have your safety plan finalized. Your staff needs to be trained on the new policies and procedures, and you need to have all of your required PPE and cleaning supplies on hand. If you do rent out your space, stay in contact with your tenants. Just keep them up to date on your plans and policies as you figure them out. And again, just because we can reopen does not mean that we need to. So at this point, we'll just dive right in. There are no guidelines for arts at this point. The trend has been for the state to release the guidelines as we're entering the phase or just slightly after it's already open. However, that does not mean that you should wait until the guidelines are released to start your planning. Based on the guidelines from phases 1 and 2 and essential businesses, we have compiled what we anticipate will be the guidelines and requirements that we will see in phase 4. Again, we do not represent the state. We do not make any decisions on what is required or allowable. We are just here to present the information that is our best guess of what we think will be required based on what we've seen and researched. It's up to you to monitor the website. It is forward.ny.gov. And stay on top of the changing regulations and new rules. They are changing pretty regularly, sometimes daily. As we enter phase 4, you will be required to read the guidelines that are set forth by the state and complete an online affirmation form stating that you have read them and that you promise to abide by them. You will also have to have completed your safety plan and trained your staff on it. Your safety plan will detail how you are preventing the spread of COVID-19. The state does have a template available that was emailed out. The copy of the first page is also on this screen. You can use that. You can also just create your own template. Please note, this plan does not need to be submitted to the state before you reopen. However, you must have one, and it must be readily available in the event that you are audited by the Department of Health. If you can't show them your plan or logs or any of the other required things that we will get to, they will shut you down. This is meant to keep you, your employees, and your patrons safe. It is a lot of work, but it is worth it in the end. So what does this safety plan need to include? There are 5 key areas that need to be in your safety plan. They are physical distancing, personal protective equipment, also known as PPE, cleaning, hygiene, and disinfection, communication, and screening and contact tracing. I am going to walk through some of the guidelines that we've seen and assume will remain in place for phase 4, starting with physical distancing. So per the phase 2 office reopening guidelines, you may have no more than 50% maximum capacity in your building based on your building's certificate of occupancy. We're assuming this will hold true for phase 4. We will talk in the coming weeks about how that number might even need to be lowered based on the size and layout of your venue and what art form specifically you represent. You must also ensure 6 feet of distance between all people at all times. Anytime an employee or a visitor needs to be closer than 6 feet apart, everyone must wear appropriate face coverings. Tightly confined spaces such as elevators, supply closets, personal offices should be limited to 1 person at a time. If this is not possible, you can have up to 50% capacity, and everyone must be wearing an acceptable face covering or other PPP as is required by the job. You must establish designated areas for entry, deliveries, and pickups, limiting contact whenever possible. So if your building or facility has multiple entrances, you should choose one that people will be entering through or that is for pickups and deliveries. And you should reach out to any contractors or delivery people who would need to know that information. For your staff, workstations should be at least 6 feet apart or maybe modified or altered to allow for proper social distancing. When this is not possible, employees must wear appropriate face coverings. You could also install physical barriers such as plexiglass in accordance with OSHA guidelines. So making sure that the space is well ventilated and there's appropriate airflow. If you have shift workers or other employees who need to share a space, you will need to have a strict cleaning and disinfecting policy and practice in place. And I will explain further about cleaning, disinfecting when we get to that section. You should also limit in-person meetings as much as possible. If you do need to have an in-person meeting, you must comply with the physical distancing regulations and hold the meeting in an open, well-ventilated space with appropriate floor markings to indicate 6 feet of distance. I will cover more about the floor markings when we talk about communication. So a few best practices. These are not in the guidelines, but they are in some of the state's documents as best practices. Limit in-person presence in your venue, space, or offices as much as possible to only essential or necessary staff. Again, just because we can be there doesn't mean that we have to be. We've been proving for the past couple of months that we are able to work remotely, and many of us are already set up for that. If it works for your organization and that staff is able to continue remote work, you might want to consider that. You can also adjust workplace hours or schedule your staff in shifts whenever possible. So for example, you can assign certain staff members to go into the office on certain days of the week only. That way they still have access to everything they need in the office, but they're not there every day. You will also need to streamline foot traffic in any narrow places such as aisles, hallways, staircases, anything like that. So this means directing your employees and your visitors to enter one way and exit another way. Stay to one side in hallways, maybe wait on a landing of a staircase if someone is coming down or up the opposite direction as you. This is just meant so that 2 people don't have to cross within the 6 feet of each other. The state refers to this as reducing bidirectional foot traffic. So let's move on to PPE. All organizations and businesses are required to provide appropriate PPE at no cost to their employees. This includes acceptable face coverings, face shields, gloves, or gowns, or other things that might be required for your staff to remain and feel safe. For administrative staff, this might just mean face coverings. For cleaning or maintenance staff, that might mean some additional things. Employers must have this available, but they also cannot prevent employees from wearing their own PPE. So if someone has a creative personalized face mask, they have to be allowed to wear that if they want. However, you cannot require that they bring their own. You have to provide it for them. So what is an acceptable face covering? I've been mentioning that a few times. Per the CDC, acceptable face coverings include surgical masks, homemade sewn masks, quick cut masks, and bandanas. There's more guidelines on their website if you need more information. All face coverings must be cleaned or replaced by the employer after every use, when soiled, or when damaged. Face coverings cannot be shared, one person per face cover, until they're cleaned or replaced, and they should be properly stored. At this point, there is no guidance for providing PPE free of charge to volunteers or independent contractors. However, if you have a regular base of volunteers, or you call certain staff-like positions independent contractors, or you ask an independent contractor to work in your office, it might be in the best practice to provide that for them. However, at this point, there is nothing from the state mandating or stating either way. Quick note about PPE. We've been hearing that it can take about 2 to 3 months to receive some of these orders. There is a high demand as everyone's trying to order it right now. We recommend ordering your PPE as soon as possible. Hopefully you all saw Jen's email. I believe she sent out yesterday from the Western New York COVID-19 Community Response Fund. They are ordering, they're placing a bulk order, so everyone who needs it can get cheaper discounted product through them. I believe the deadline was extended through today. So if you need access to that, if you did not receive it or can't find it, reach out to Jen, email her after today's session, and she can forward you that information. Okay, so cleaning, hygiene, and disinfection. All organizations and businesses are required to adhere to a strict hygiene and sanitation process per CDC and Department of Health regulations at least once a day, with more frequent cleaning in shared objects and services and high transit areas. So some examples are the bathrooms, kitchens, other common areas, things like your printer, copier, things that multiple people will be touching. You are also required to maintain a cleaning log that details the time and date of the cleaning, the person who did the cleaning, and the scope of the cleaning. This is why it's really important to train your staff on these policies. So if someone does clean up a bathroom after they use it, they know that they should also be logging that for your records. Again, just in case the Department of Health ever has any issues or questions, you have that information. You must also provide hand washing and hand sanitizing stations. So this means easy access to soap, warm running water, disposable paper towels, a lined garbage can, and hand sanitizer containing at least 60% alcohol. And finally, prohibit or limit the use of shared food and beverage. So buffet style meals are probably out. This includes shared coffee pots, which I know we need the coffee, so just come up with a protocol for cleaning the coffee pot after people get their coffee. You can figure that out, I am sure. So a few best practices. Whenever possible, you should ventilate your space by opening doors and windows, especially for office spaces. I know that some of you have collections and archives that need to be temperature and humidity controlled, so this wouldn't work for that. But in general, whenever possible, you should be recycling your air. You should encourage employees to bring lunch from home and make sure that you have reserved adequate space for meals that observes the physical distancing rules. And finally, if you're able, I know this requires money, but if you're able, install touch-free amenities such as water fountains, trash cans, hand dryers. I know none of us have revenue, or we have limited revenue coming in at this point, but if this is something you are able to do, you should consider it. All right, communication. So establish a communication plan for all of your employees, visitors, patrons, and contractors with a consistent means of providing updated information. So this is if there are any changes to your policies or procedures. This is also for contact tracing purposes. So you can use things like group emails. You can have a web page on your website dedicated to this information, a group text, or your social media pages. You also need to train your employees and independent contractors on your plan and your procedures before you open. How you do the training is up to you, but everyone needs to feel comfortable and understand the plan before enacting it. You also need to post signage throughout your venue, reminding employees and visitors to adhere to proper hygiene, physical distancing rules, appropriate use of PPE, and your cleaning and disinfecting protocols. And you also need to post physical distancing markers that denote 6 feet of space in commonly used areas. So I mentioned this or referred to this earlier with the meeting space. You can use tape, you can use signage, anything where people are likely to gather or queue up, such as a box office will call, admissions tables, gift shops, concession stands, anything like that. Think of Wegmans, their checkout line. They do have it marked on the floor clearly how much space you're supposed to put between you and the person in front of you. Another log, you will have to maintain a log of every employee or visitor who may have close contact with someone else in your venue. This is for contact tracing purposes. So this doesn't include deliveries or office workers if they are wearing appropriate PPE and are appropriately physically distanced. However, if 2 people need to work in a tight confined space, or you have an exhibit that has a very heavy but small piece that requires more than one person to lift and install it, anything that brings people together closer than 6 feet where they are working together for a period of time, you will have to log that. If an employee or visitor tests positive for COVID-19, you must immediately notify state and local health officials and cooperate with their contact tracing protocols. So in order to enable contact tracing protocols, you will need contact information for every person who comes into your venue. So every employee, every contractor, even your patrons and visitors. This may just mean that you require an email or phone number for everyone who comes in. If someone is diagnosed with COVID-19, you will be required to notify everyone who may have come in contact with that person, while maintaining confidentiality per HIPAA laws and regulations. The Department of Health will guide you through this process, but you will need to have this in place. You should also familiarize yourself, if you're able, with the HIPAA regulations so you don't breach any confidentiality by accident. So a few best practices. This is a very difficult time for everyone. You should really be paying attention to the mental health and safety concerns of your staff. It's been hard going up until this point. It's going to be hard going back into the work where you are with other people. We want to make sure that everyone feels as safe and as comfortable as possible. In addition, you should consider having an open door policy if you don't already, and making sure that all of your employees know who they can go to if they are struggling or have a concern. This is where you can make reasonable accommodations for your staff, including to, the workspace, physical presence, whatever their concerns are. So we have one more section and then I will stop talking. We are going to talk about screening. You will have to implement mandatory health screening for every employee before they begin work in your building or venue or office every single day. If it's possible, you can also do this for guests, visitors, and contractors, but at this point, the state is only requiring you to screen your employees. Screenings and assessments can be in the form of a temperature check as they are coming in, or a questionnaire, and the questionnaire can either be done in person or remotely, such as by email or phone. If you do use a questionnaire, you just need to make sure that you are asking if they have knowingly been in close contact with someone who is tested positive for COVID-19, if they themselves have tested positive for COVID-19, or if they have experienced any symptoms from COVID-19 within the past 14 days. With your questionnaire, you cannot address any protected issues or classes, anything such as underlying conditions or disabilities. You also must implement your screening exactly the same way for every single employee. This is to protect you from potential lawsuits and any liability. You cannot treat people differently because of their physical ability, age, race, gender, etc. So just across the board, implement everything equally, exactly in the same way. You must keep a log of your screening assessment responses that will be reviewed daily. This must also follow the HIPAA regulations for confidentiality. So getting into our screeners, the people or person who is doing the screening and tracking and reviewing the screening logs. This person should be familiar with HIPAA regulations. They should also be familiar with, and if possible, trained in CDC, Department of Health, and OSHA protocols. If they are doing in-person screenings, such as temperature checks, they should also be provided and wearing appropriate PPE. If someone feels ill, they should stay home. Always, but now more than ever. This includes your visitors and patrons. So this just means that you need to think of a plan or have a process for refunding or changing tickets or admissions, just in case. It's better to keep them home than to have them risk coming into your venue and potentially infecting others. If someone falls ill or presents COVID-19 symptoms while at work or in your venue, they must immediately leave and contact their healthcare professional to get tested. Employees who have tested positive for COVID-19, regardless of whether or not they are showing symptoms, must stay out of the workplace for a mandatory 14-day quarantine. This doesn't mean that they can't work remotely. They could still work remotely if that's an option. They also cannot lose their job because of a positive diagnosis. You have to guarantee that they are going to have their job after this quarantine period ends. For employees who have had close contact with someone who either has been diagnosed or is confirmed or assumed suspected of having COVID-19, they should notify their employer immediately. And then you guys can work together to see what makes the most sense, whether it's just tracking symptoms, increasing temperature checks, enforcing stricter PPE use and sanitation policies, or again, if they're able to work remotely, maybe that's an option. But this is where having that open door policy and open line of communication would be helpful, just to make sure everyone feels comfortable going to you if there is an issue. So that's it. It's a lot, I know, but these are the primary areas everyone should be starting to think about. I would recommend, before you finalize your plan, or even in the process of planning, you should have a legal representative and an HR representative look through the plan, walk through the process with you, just give you advice to help limit liability as we move forward. This can be someone from your board or someone you have on retainer. If you don't have anyone like that within your organization, reach out to us. We can help put you in contact with someone. So at this point, I would like to introduce Marisa Wigglesworth from the Buffalo Museum of Science, and she's going to talk briefly about some of the things they are implementing and considering as we move forward this.
So for us, and again, reflecting, just because we can reopen doesn't mean we should, and we should certainly not if we can't do it safely. At the Buffalo Museum of Science, we recognize an opportunity and an urgency to open as soon as we are safe and ready, because we want to capitalize on the opportunity to share the Golden Mummies of Egypt exhibit with our community. So we are pressing a little bit. We are hoping that we will be ready to open as early in New York State's phase 4 as possible. So with that, we are looking at a great variety of protocols and how to do this well. Our plans right now for the public include only sales by online advanced ticketing. That will both allow us to ensure that we are controlling the number of people who come into the building at any one time, so that we are not exceeding whatever capacity limitations come down as part of the New York State Phase 4 directive. And it will eliminate the need to do any financial transactions on site in the moment at the admissions desk, for instance, thus eliminating one more potential health risk. Now, we recognize that not all of our guests will be comfortable making a purchase over the internet online with a credit card. So we are also putting practices in place where we can help those guests who want to talk to a real person in buying their tickets. So there's a number of additional technology mechanisms that have to be put in place to facilitate that. Right now, we anticipate that we will require every guest coming into the museum to be wearing a mask. There will probably be an age limit on that, a minimum age limit, but we will be requiring masks for entry to the museum. To do all of this well, we also recognize communication, that we need to tell our visitors in advance what to expect before they come into our building, and so that they know the steps we are taking to make sure they're safe, and so that they come prepared to engage with us within the guidelines that we are outlining. So we're in the process now of developing communications, perhaps a video, a variety of mechanisms to help guests know how to engage with us in the ways that's going to give them the best possible visitor experience. Our phase 2 initial opening will likely be, as I said, the second floor of the museum only, and beyond that, only members of the museum and individuals buying Golden Mummies of Egypt tickets. Again, because it's an important opportunity for us to capitalize on that exhibit. Beyond that, we know that we have a whole lot of adaptation to do in the rest of our building before we can have every assurance that our third floor experiences, our fourth floor experiences, and our first floor experiences are safe for us to reopen to the public. So we know that that's what we're going to call our phase 2 plan, and we actually don't even have a timeline for that yet, because we are still in the process of understanding the depth of those adaptations, the time and the money they'll take to do it well. And I want to reflect on a couple of things that have already been said in the presentation today, but really just to underscore them. I think it was Holly who talked about the importance of thinking ahead when you need to build up your supplies of PPE and your consumables around, cleaner and sanitization gels and fluids. I absolutely just want to underscore that. We don't want to wait until it's phase 4 for folks to be putting in their orders. Then we're all going to be delayed by something that that is going to feel like a needless delay if we don't get out ahead of it. David talked about the importance of communication with all of your audiences. You want them to have every understanding, every assurance that that they're going to have a good and safe and comfortable experience in your organization, be they staff, be they visitors. The third one I want to note, though, and I don't think it's come up here, and I do want to stress it, is that we absolutely want to be documenting our processes. Holly noted that we have to have our opening safety plan, and while we don't need to submit it to the state, if we get audited, it needs to be available. We want to document not only that the plan exists, but that we're following the plan. So we are going to not only document the health screening that happens for all staff every day and that each staff member will be signed off on, but episodically, we're going to document that we did the health screening every day as was outlined in our plan. Documentation, documentation, documentation is what's going to keep your organization safe. Should you be audited, should there be a need for your organization's practices to come into question. So I'm happy to answer any questions or talk further about specific plans at the Buffalo Museum of Science or TIFT. And with that, I guess I'm turning it back over to Holly just now.
Actually, I will jump in. It's Jen again from ASI. Thank you, Marisa and Dave, so much for sharing what your organizations are doing. I think it's really helpful to give it context as far as, we can go through the steps and the guidelines and the templates and sort of the basic information that the state is giving us, but hearing from both of your perspectives and your organizations on what you're actually doing boots on the ground is extremely helpful to the field. And also, in addition to that, what we were really thinking about when we had these conversations with Marisa and Dave was that we understand that all arts and cultural organizations, they're different size and scope. Some of you have your own buildings, some of you don't, some of you rent, some of you have all volunteer staff, some of you have small staff, large staff. There's no one size fits all, but what we've been learning through conversations is that at least for organizations that may be larger in size, own their own buildings, you can always take their steps and their experiences and scale that down to fit your organization and what best meets your needs. But as Holly said earlier, there are the standards of filling out this form, the affirmation form, having the safety plan in place, but then looking internally at your own organization. So my last parting comments before we actually move into the Q&A, because we have quite a bit, and I'll hand it over to Rochelle to moderate that, is, thinking about your organization and first approaching it from an internal perspective of whether you have paid staff or not. Get some staff members together on a committee. Your board members, absolutely, they have their fiduciary and other responsibilities, duty of care, duty of obedience to your organization. Get them together on a committee, maybe some of your volunteers, maybe some other invested partners that you work with, and really start putting those task force together, because this is going to have an impact not only on you and your staff, but also others that you work with. Maybe it's some of your members or community members that you work with a lot, or your supporters and donors. Get them on that committee, and then move forward in having those conversations. But I do want to take some time and make sure that we address everyone's questions. There's quite a handful, so I will ask Rochelle to jump on here, and she has been monitoring and tracking the questions that you've been submitting, and we'll go from there, and whomever it is, myself, Holly, Dave, or Marisa that can answer them, we will be here and see if we do have an answer for you at this time for your particular question.
Thanks so much, Jen. We've got a couple questions in the chat regarding the PPE order. The first is, are we going to try to bulk purchase other items in addition to masks? And one person in particular suggested hand sanitizer.
So I will chime in there. What Holly mentioned earlier, an email that was shared through the Western New York Nonprofit Support Group, that information, that bulk order form that is sent out, it has a range of materials from gloves to shoe coverings, face mask, hand sanitizer, some disinfectant cleaning. So that is an option there. I did share my email in the chat. So if you did not receive that email and you're interested in looking at that bulk order form, please let me know and I'll get that to you immediately after this. Right now, that is the one option that we know of here locally where we're trying to have a cost savings of if we buy in bulk as a field, as a sector, as the nonprofit sector across the board, how can we get a cost savings on that? The other thing I would recommend is, I know they have minimum orders. So if you're a single organization putting a minimum order in, for example, hand sanitizer, the minimum order is 10 gallons. If you don't think your organization needs 10 gallons, you only need 5. We can put you in contact with other small to mid-sized nonprofits that maybe only need 5 gallons as well, and you can split that order. So really working together on that effort.
Great. We have a couple questions about masks. The first is regarding the need for masks to be cleaned. Is that the responsibility of the employer? Do they need to take the masks home every single day and launder them, or is the responsibility on the employees to clean them at home?
I'll jump in there. As far as I know, it is the responsibility of the employer. If your employee owns their own mask and they are using that, have a conversation with them. They might feel more comfortable laundering their own mask. If it is something you are providing to them, it is your responsibility to clean it.
Great.
As far as I know.
Sort of in the same vein, can staff self-screen at home, or do they have to be screened on site? We're talking here about temperature screenings.
No, someone from the organization has to do the screening.
And I'll note as well, you do want to track that information. You do want to have it documented, and it does need to be confidential. So if staff were to be screening from home, that's just another level of complexity. How is that information being tracked in a way that it is, fully confidential and protected under the organization's guise?
Right. Another person asked, so staff members have to be as far as 6 feet apart. And if they are closer than 6 feet, that has to be logged. Does that count even if they're wearing masks?
I'll try to answer that. I think it depends on what they're doing and how close they are. So if you're in an office space and someone's sitting 4 feet away from you, you're both wearing your masks, you're both doing proper cleaning and hygiene, maybe not. But I actually don't have a great answer for that. I don't know if Marisa and Dave have a better answer.
Right, not.
Okay, to be determined. We've got a couple questions that are also related to whether or not people are going to comply with all of these new regulations. We're thinking about guests, but we're also thinking about employees. What if an employee refuses to complete, for instance, the screening questionnaire or any kind of preventive measure? Does anyone have a sort of plan for how they're going to handle that?
Dave, you need to unmute yourself if you're talking.
Oh, there it pops up. Okay. We at the Botanical Gardens have, the task force has discussed that. And as we reopen and bring the remote staff back in, there will be conditions under which that they have to agree to. And one of them will be obviously what we're talking about. All the social distancing requirements will be there, and they will sign an affidavit indicating that they support that. If they choose not to do that, then our obligation to have them come in is gone. And we'll check into that legally. I think you really need to take a close look at that, but I think we would be within our rights to do that.
Thank you, Dave. In the same vein then, what about for guests? Could we get some clarification on the governor's executive order regarding mask use and how that might apply for guests who don't wish to wear them?
This is Marisa, and it would be our intent. We intend to, in the information that we'll be sharing with guests before they come to the organization, and ideally even before they purchase their tickets, it will be our intention to cite the governor's executive order regarding masks and let guests know, again, as the point where they're purchasing their tickets, that they will be required to wear masks when they come on to the property. So I wonder if ASI can share that language out specifically, if that would be useful to to other organizations.
And I'd like to add too that the governor was very clear the other day, giving several examples about individuals coming into a storefront and not wearing a mask, that the owner or the proprietor had the legal authority to ask them to leave.
Okay, great. We've got a really good question about contact tracing. This person is speaking from the perspective of running an indoor performance venue, but I suppose it could be more broad as well. Are we required to log every patron, performer, volunteer, staff member who enters, and what kinds of information are we required to collect? So phone numbers, emails, that sort of information, and how long do we need to retain the information?
That's a good question. I'm not sure if any of us have a great answer for that. As far as I know, any staff, you do have to take temperature checks or screenings or anything like that. Patrons, you don't have to, but you do need some form of contact information, if at all possible. We can, I guess, Jen, we can talk to the Department of Health and see if they have specific regulations. I don't know if Marisa and Dave have come across anything specifically. It's all pretty vague at this point.
That's just as you said, Holly, my understanding is some means of contact, but I don't believe there's been any specificity around whether it needs to be a phone number and an email, for instance.
Right.
I would assume, and please take this as you will, as I'm making an assumption, even as we've seen as the communities open up for phase 2 today, one of the examples I keep referring back to is the case of salons, where 2 weeks ago, before we even went into phase 2, I think a lot of salons were just anticipating the very basic 3-ply masks that they would put on for their staff. And then as of today, a couple of days ago, it was shared that they need to wear the actual face shields. And so that was a changing element of what it meant to reopen in their phase within a day or less time. And then which Erie County announced that any businesses that need that in order to meet that requirement can contact the county. And so I think those are some of those elements that we just won't know until leading right up until whenever phase 4 comes into play.
Right. And one person also suggested in the chat that an easy way to collect contact information is to eliminate sales at the door if you are charging for entry, and to do that in advance online so that there are fields that patrons can enter for their phone number and email address. We've got a couple specific questions about concession stands and gift shops. How will concession stands be affected? We know that it's ideal for items, for instance, to be prepackaged, but what about pouring glasses of wine? Something that the arts sector loves to do.
This is Marisa. I can only speak to at the Buffalo Museum of Science. That's something that we are deferring, but beyond our phase 1 opening plans, we recognize it is a very big and complex thing to tackle, and we're quite honestly kicking that can down the road a little bit. So I'm sorry I can't be helpful there.
Yeah, I would say once bars can reopen and restaurants can reopen for in dining, there will be better and more clear regulations for that that might give more guidance, hopefully.
Great, thank you both. Could Dave and or Marisa share more about how they plan to reopen their gift shops, especially as it relates to browsing, since we all know that people love to touch every item and then put it back in a random place?
This is Marisa. Love the question. Again, we're kicking that can down the road. Perhaps Dave has some better information than I.
Well, that can's getting beat up, so we know it's not going to be in the our first phase, more likely in the second or third phase. And again, because of the touching aspect of it, our gift shop is very small, so we're not doing that right now. We're looking at online purchases and curbside pickup. We've just had an excellent experience with our great plant sale, where we've sold probably over 700 different orders over the past several months, and pickup is happening now. And curbside pickup has run very smoothly. Time set for individuals to come and pick up their plants. Their plants are put in a specific location in the parking lot where they know to go, and they pick them up and they leave. So there are ways that we're exploring to address gift shop sales, and certainly it's not going to be for a while before we begin that.
Great, and then the only remaining question is something that I think that we can answer next week, but I'm going to pose it now. Is there any guidance at all yet about on-site outdoor events or festivals late summer, early fall of 2020? I do know that we're doing a breakout session next week. I'm going to turn it over to Jen now to talk about that, and where we can answer that question as well as related ones in the coming weeks in June.
Thank you, Rochelle, and thank you everyone for asking the questions and answering the questions as well. As you know, we have a mix of things that we feel confident addressing and we know well about, but I think there are definitely other areas in which we have to wait until we get a little closer to that point. But next week is really where we want to break out into different discipline areas, because as I mentioned before, it's not a one size fits all, whether it's the size and scope of our organizations, our staff, our patrons who we serve, the types of programming that we do, whether we own a building or not, whether we rent or not. And so we really wanted to focus next week on breaking out different time slots throughout the day in which individuals representing arts organizations in particular categories can join together and share their similar concerns, because we know that, you know, if you're a performing arts organization, you may have a completely different set of things that you need to think about if you're just doing workshops and classes, or if you're an organization that solely does workshops and classes but going physically into the schools, right? That's a whole nother set of challenges and issues. And so we want that time and space for the disciplines to get together. And even though these are broken out into different time slots, you have the ability that if you want to spend the whole day with us and you want to spend 1 p.m. until 5 p.m. with us, I mean, feel free. You can join any or all, pick and choose. We'd love to see your face, so that would be great. But really, that is the intent of next week, because we think a whole nother set of challenges and issues will be brought to the forefront, in which once that gets brought up, we can tailor our next set of series to be a little more specific to your organization. So today's session was meant to be overview, high level, all the million things you need to be thinking about, right? But rightfully so, and just being ready to get into that planning action mode. Next week and future sessions will be particular artistic discipline, but then coming back together as a sector, because we create that ecosystem, right? We're all needed. All of our disciplines are needed. Our size and scope of organization are needed. Where we're located within the 5 counties of Western New York is needed. So really, I just want to close on that note, saying anything that we did not address in the Q&A or any follow-up questions that you have, please send them to myself or Holly or the team. We'll definitely follow up with materials and links. Thank you to Marisa and Dave for participating and sharing your stories. Thank you to Holly for compiling all of this and scouring over the last month all of the different state and different guidelines. And thank you for just being here, being ready to hit the ground running, and we'll all get through this together. So thank you very much, and hopefully we will see you next week. Okay, take care, send us any messages you want, and next week will be participatory, so we'll definitely interact and share each other's ideas with each other. Thank you.